Welcome to part 4, grant writing for schools. Today we're going to talk about what's data got to do with it, why data is so important when writing your grant. The disclaimer, funding for this project was provided through a grant from Delta Dental of Arkansas in collaboration with School Health-Based Alliance of Arkansas and Healthy Active Arkansas. The intention or information and opinions expressed by the author in this presentation do not necessarily represent the official views of Delta Dental, the School-Based Health Alliance of Arkansas, and Healthy Active Arkansas. So, what is it that you want to do with your grant funds? How do you know what you want to do? What are your needs? How do you know what your needs are? What's your proof? Really, it's all about proving that you have a need and showing why you need these grants. So how do you know you have a need? How do you know? If you use data, it can justify the need for requesting grant funds. Data can be the proof, and the proof is what the grant readers are looking for when reviewing applications. So data is really crucial, important, crucial data that links specifically to what you're trying to do. They're going to look at your applications and they're going to ask some questions of themselves. They're going to ask themselves, did you prove that you need these grant funds, that you have a need for the grant funds? How did you prove it? What data did you prove or use to prove that you have a need that justifies you being granted grant funds? Is the data that you used, is it relevant? Is it current? Now, we all know that sometimes data is not current, but trying to find the most updated current data you can find is sometimes the best you can do. Try to avoid using old data. They're going to also look at where did you get the data? How'd you get the data? Where'd you get it? This is where you have to cite it. Cite all of your data sources, where you got them, who provided the data. They're going to look to see if you looked in research journals. Or did you get it off the internet somewhere? You're going to have valid data sources for the justification. Did you do a needs assessment? Sometimes getting local data in your agency or your school is just putting together a simple needs assessment to give to students, your staff, to show what's going on. And sometimes they don't have to be too involved, but sometimes that's the best data there is to do a local needs assessment right there. The bottom line is they're going to look for valid data that ties to your needs. You've identified your goal and the need to write for grant funds. Do you have the data that can support your need for the grant funds? If you don't, you're not going to get very far with your application. Just because you know it needs to be addressed without data, your likelihood of getting that grant funds is not going to happen. You know you have a problem, go find the data to support it. Grant reviewers are going to look for reliable data supporting the need, supporting your need for these grant funds. And it can be found out there. You just have to look. And like I said, sometimes that's a local needs assessment, data collection, right there locally. Where can you find data? Well, there's several sources that you can find data. This is a small list compared to the potential of locating data sources. The Youth Risk Behavior Survey, Arkansas has a long history of doing the Youth Risk Behavior Survey, so there's a lot of trend data that's available. You can get Arkansas data, you can also get national data. If you just Google Youth Risk Behavior Survey, you can get all kinds of information. The Youth Risk Behavior Survey is taken by high school students, and they are questions on their risk-taking behaviors related to nutrition, physical activity, drugs and alcohol, sexual behaviors. There's a lot of good information, and it's student generated. The BMI, the body mass index, well, there's a big discussion on whether that's really valid data. At this point in Arkansas, it's as good as we can get right now for a lot of physical activity and fitness stuff. So, and we have a lot of data in our state. So, like it or not, BMI can be a good data source for you to use when writing for certain grants. The School Health Index is also a school survey, but it is completed by a principal and a health teacher in a selected school building. The principal will answer questions related to policy and things of that nature, especially related to tobacco and other things. The teacher survey is more specific to what's being taught in health education, content areas, skill levels, any professional development they have attended, and any professional development they would like more training in the future. So this is a good way for us to look and see what's being taught in health education to our students in health-related areas. So census data is not just about numbers. There's a lot of really good information with census data. If you're in a impoverished area or a high poverty area, the census data can be a really good tool to use to show that you have limited resources, and this grant fund will help because you have limited resources. The Annie Casey Foundation and the Kids Count, actually Annie Casey Foundation does the Kids Count, and actually the Annie Casey Foundation has a lot of efforts here in Arkansas in meeting the needs of our children. We're one of the few states that has some targeted efforts. So the Kids Count data and the Annie Casey Foundation, they have a lot of really good data about our kids that can be used for grants. So those are really two good resources that you can find. Any of these you can just Google and they'll come up. Centers for Disease Control and Prevention, CDC has a lot of data. You just have to look for it, but there's a lot of data that can be used. The Department of Health also has a lot of good data. If you're looking for it, they have the Prevention Needs Assessment Survey, the APNA survey, that also can be a good resource for some data that you might need for your grants. Again, if you want to do local student, staff, community surveys, needs assessments at the local level, those really do go a long way too in picking out needs that are going on in your community. So you want to ask yourself, is the data relevant to what your needs are? It's not relevant if it doesn't support it, if it's not a tool that you can use to prove that you have a problem, you probably don't need to use it. I've not seen it, but you can use too much data. Be careful with the data that you use. Make sure it is absolutely relevant to what's going on. And if you're not sure about the relevancy of it, then you better be really good at explaining how you see the relevance between the data that you're providing and the needs that's going on. Does the data show support for your needs? Does it support why you should be funded? Data is a real good tool to say, you know what, here's the poverty level, here's the amount of doctors in the area, we need some help with this. So we need a school-based health center. So there's reasons, there's data out there that can show why, and the data will be that crucial piece. The other thing to think about is by implementing your program it's not going to be impacted within 1 or 2, 3 years. But in the future, if you continue to do what your program is, can this data be impacted with the implementation of your grant funds on down the road? That's something to think about. So I've got a couple examples. to look at. So earlier in in the series, we had the goal for the reduction of adolescent STD rates in XYZ. So possible data sources that could be included in the application. STD rates among adolescents that can be found at the Department of Health, and at state and local level. You can probably find some data at the national level too. And that would show high rates of STD rates, which would show a need. Students being taught sexual health education. That data can be found in school health profiles. The teachers report on what content areas they're teaching. And if the survey shows that, not very many teachers are teaching it, then, that'll help us focus on, well, we need to strengthen that piece. So if a low number of students is being taught, then my efforts to train teachers and ultimately students, that ties in with a good data source. Students reporting sexual activity, that's also reported in the Youth Risk Behavior Survey, and that can be a good source. 49% of the students reported ever being sexually active. So those can be some good data sources to show a need for the programs to address STD rates in Arkansas. And here's another one for the water access, increasing access to water for school-age children, data sources. You could do a local survey. Ask how many students are using the water fountains on a daily basis. You can have somebody monitor one of the fountains in between class changes and just do a little tick mark every time you notice a student using the water fountain. That's a data collection source. And if you do that over 2 or 3 days for the same period, and on average X amount of students use the water fountain, and if the number's low, then there's some data right there to show that students are not using the water fountains in school. Drinking water among students. There's questions on the Youth Risk Behavior Survey about water consumption, so you can use that data as well. And then information on the benefits of drinking water. There's a lot of research out there, CDC, and on their Healthy Schools website page. There's a lot of information on the benefits of drinking water. So that's some data you can use to show that, hey, if they drink water, they're going to be better suited for learning in the classroom. So those are some examples of data that you can use to justify what you need to do in your application. Make sure that the data you use is relevant to support the need you're requesting funding for, and it should support your problems and support your need to make desired improvements. The next part will be completing an action plan or work plan for a grant.